Lady of Lourdes Hospital is committed to its vision of being a standard of service excellence. One of our main goals is to address major healthcare issues affecting overall care to patients. A prevailing problem among hospitals worldwide is the incidence of pressure ulcers. Hence, in Our Lady of Lourdes Hospital, strategies to prevent this condition are implemented.
By definition, pressure ulcer is a skin lesion caused by unrelieved pressure, resulting in damage to underlying tissues. Pressure ulcers are also known as bed sores, pressure sores, and decubitus ulcers. Within this presentation, we are going to help you understand how pressure ulcers can develop and how we can help you to prevent them from happening. Pressure ulcers can begin to develop in a few hours and can be worse over a number of days if pressure is not relieved. When pressure is against your skin from a surface such as a bed, chair, or even your shoes, the surface presses against your skin and squashes the skin surface as well as the deeper tissues close to the bone. Blood vessels normally run through your skin, keeping it healthy with oxygen and nutrients. When these blood vessels are squashed by pressure for too long, they can no longer keep that part of your skin healthy and pressure ulcers start to develop. It can be seen as a red or inflamed area in the skin. You may feel discomfort, pain, or numbness, which are warning signs that something is wrong. Where can pressure ulcers develop? If you are a bed-bound patient, pressure ulcers can develop in your buttocks, elbow, ears, spine, shoulder blades, heels, hips, back of the head, and tailbone. If you are a wheelchair user or sitting in an armchair, you are more at risk of developing pressure ulcer in your hip bone, buttocks. How do I know if I have pressure ulcer? The best way to test an area of skin for pressure ulcer is to look at your skin and carry out a skin test. If you see any reddened areas over the bony parts of your body, you can lightly press the area with your skin and count to 15. When you remove your finger, the area that you have pressed should be white or blanching. This means your skin remains healthy. If you have dark skin, it is likely that you will see the redness or the blanching. So be aware of pain or purple discoloration around the bone. If you notice warning signs of bed sore, change your position to relieve the pressure on the area. If you do not see any improvement within 24 to 48 hours, contact your care provider. Seek immediate medical care if you show signs of infection such as fever, drainage from a sore that smells bad, or increased redness, warmth, or swelling around the sore. How serious can a pressure ulcer be? There are 4 stages of pressure ulcers, and it is important that you are aware of each stage and understand that if left untreated, they can become more severe. Pressure ulcers are painful and can take weeks or months to heal, so it's best to prevent them in the first place. Stage 1 pressure ulcers are often discolored and do not turn white when pressure is placed in the skin. This may hurt or itch and tend to feel warm or spongy. This stage can be prevented from getting worse but must be managed as soon as possible. In stage 2 pressure ulcers, the outer surface of the skin and part of the second layer of the skin are damaged. The outer looks like an open wound or blister. This can happen from prolonged pressure but can also happen if you drag your skin across the bed or chair. In stage 3 pressure ulcers, skin loss occurs throughout the entire thickness of the skin. The underlying tissue is also damaged. This appears as a shallow or deep cavity-like wound. In other words, a hole in your skin. Stage 4 pressure ulcers are severe. The skin will be badly damaged, and the surrounding tissue begins to die. The muscle and bone could also be damaged. Stage 4 pressure ulcers can lead to life-threatening faction. So, it is important that you get them treated as soon as you notice the first symptom. Who are at risk? Although older people have a greater risk of developing pressure ulcer because of different health conditions, remember this can happen to anyone. Immobility. Once you lost the ability to move and become inactive, the risk of developing bed sore increases. A physical disability, paralysis, multiple sclerosis, stroke, or dementia can render a person immobile and put him at risk for developing pressure injury. Lack of sensory perception. Spinal cord injuries and neurological disorders can result in a lack of sensation. An inability to feel pain or discomfort can result in not being aware of warning signs and the need to change position. Aging. As you age, your skin becomes thinner, more fragile, and less elastic, thus increasing the risk of skin breakdown and reducing sensory perception. Poor nutrition and hydration. You are at risk of developing pressure ulcer if you do not eat or drink adequately. Poor nutrition can lead to weight loss, which can increase the pressure on bony areas of the body. There are many physical, functional, and psychosocial factors that can contribute to inadequate intake, unintentional weight loss, undernutrition, food-medication interactions, gastrointestinal diseases, and impaired ability to eat independently. Despite the presence of risk factors, it is worthy to take note that pressure ulcers can be prevented and effective strategies can be carried out to address this condition the earliest possible time. How is pressure ulcer prevented? Your care providers can assess your individual circumstances and will take into account your ability to recognize pain and your ability to move. Your diet, continence state, and blood circulation will also be assessed. They can help create a plan of care specifically to meet your needs. Using support surfaces. Use cushions or a special mattress to relieve pressure and help ensure your body is well positioned. Your care provider will assess your need and order the mattress and cushion required. Anti-bed sore or egg crate mattress is a special support that conforms to the shape of your body and spreads the pressure. Skin assessment. Regular skin inspection is important. You may be able to do this yourself with the help of a mirror. Alternatively, your care provider should assess your skin. If you notice any changes to your skin or any redness, you must call your care provider or attending physician. Repositioning. If you cannot walk independently, you will be at risk of developing pressure ulcer. Regularly moving is the best way to stop pressure ulcer from developing. This may be difficult, but standing for 2 minutes every hour or changing position while in your chair or lying in bed reduces the pressure on any vulnerable areas. If you are a wheelchair user, you are advised to shift your weight about every 15 minutes to take off the pressure from your buttocks and lower back. This may be achieved by doing wheelchair push-ups, raising your body off the seat by pushing on the arms of the chair. If you are bed-bound, you should change your position regularly or every 2 hours during the day. If you struggle to change position yourself, a care provider or relative should assist you to ensure that the pressure is relieved. The care provider will stand on the side of the bed, and then the care provider will lower the bed to make the bed flat. You will be moved to the center of the bed so that you will not be at risk of rolling out of bed. Your lower arms should be stretched towards the care provider and your upper arms across your chest. Your care provider will place his hand on your shoulder and his other hand on your hip. While standing with one foot ahead of the other, your care provider will shift his weight to the front foot, so he gently pulls your shoulder towards him. He will then shift his weight to his back foot as he gently pulls you towards him. When you are positioned properly, remember the rule of 30 degrees. Head of bed elevated not more than 30 degrees. Body is placed in 30 degrees laterally inclined position. Hips and shoulder 30 degrees from supine. Support pillows used for areas that press against each other. Manage moisture. The care provider will evaluate the type of incontinence, urine or feces or both, and contributing factors. After each incontinent episode, your skin will be cleaned gently with water or pH-based cleanser. and your care provider should wipe from your hips to knees using pre-moistened cloth. Perfume soaps and bubble baths are not allowed as this can irritate the skin. Absorbent underpads are selected, and when necessary, diapers are used to help absorb fluids. Also, moisturizers are applied to dry skin to keep it hydrated. Overall, your skin should be kept clean and dry at all times. Maintain proper nutrition and adequate hydration. Eating a healthy, well-balanced diet and drinking at least 8 glasses of water a day will help to prevent pressure ulcers from developing. Protein and vitamins are part of a balanced diet. You may also monitor your weight and any weight changes. If you do have a pressure ulcer, proper nutrition can be beneficial in wound healing. If you are suffering with weight loss or loss of appetite, your attending physician can refer you to a nutritionist dietitian to create the best plan for you.
By doing these 5 strategies, pressure ulcer can be prevented. Regularly look at your skin and be aware of any signs of pressure damage. Keep the pressure off, and if any changes appear in your skin, inform your healthcare provider. For any questions and clarifications, please do not hesitate to talk to any member of our healthcare team. We thank you for trusting Our Lady of Lourdes Hospital, and we assure you the quality healthcare service that you deserve.